Now we're going to introduce the iGEL and show how it's used. The iGEL packet we have at Renown contains a packet of lubricant and a retention strap, and then the iGEL has a case in it that you're going to actually use, and then the iGEL itself. So a couple of things to notice about the iGEL is it's a supraglottic airway, and it has a silicon-based cap for the airway instead of an air bubble or a balloon. And this is nice. It'll conform to the airway, but you won't have to do any insufflation. And that's what I really like about it. It's easy to place, it's quick to place, and it's easy to remove, and it's quick to remove. The other thing to notice about the iGEL in this case is with a side view, you'll notice it has a capped supplemental oxygen port so that you can take O2 from your O2 regulator and attach it to the side port, and you'll be doing apneic oxygenation if you want to do bougie intubation attempts. That needs to be capped if you're doing bag valve mask. And the other thing to notice is there's a side port here for a number 10 NG tube to decrease the gaseous insufflation of the stomach. You'll notice that there's a size here. This one's size 3 for 30 to 60 kilograms. There's a 4 and a 5 for bigger sizes. The idea is to pick the size that you think would fit and anticipate possibly using a smaller size first if it's on the border as opposed to picking a larger size. However, either way, it's not critical. When you use the iGEL on a patient, you're going to open the packet of lubricant, place it in the reservoir, and then you're going to just touch the tip. And you don't want a glob, because if you have a glob of lubricant and it gets in the airway, it's going to be blown down into the lungs. We don't want that. That's poor form. So we just want to coat it here on the sides and the back. Very simple. Now for this intubation, when you're doing the practice intubations, we want you to use water, because this is going to be used a lot and we'll just gum up the mannequin. So use water for your practice in the doctor's lounge, but know with the patient that you need to lubricate it with a small amount of lubricant. So what you're going to do to place this airway is do a slight jaw thrust. It's difficult on this mannequin, so I'm just going to open the jaw. And then you're going to just advance this over the tip across the hard palate. So you're going to be pushing it up against the hard palate, and it's going to find its way to the back. And then you advance it, and on the mannequin it is more difficult to advance than in the live patient. And you're going to have to push it until it sets. And that's it. It's placed. We've got the patient in the airway position. You're going to place the retention strap. And it's light tension, not real hard tension, but enough that this won't want to back out when you're trying to bag the patient. And it's placed. Now, let's say that you have an airway that was difficult, and that's the reason you placed this. You couldn't see the glottis. And you're bagging the patient well and everything's going fine. You may want to make an attempt at a bougie intubation. If you want to do that, take the cap off of the oxygen port, place your supplemental O2 on, and turn it to high flow. This is going to be apneic oxygenation. And it's going to be blowing oxygen down into the airway as long as the airway is patent. And that makes it a more controlled procedure. Then you can take your bougie, and we'll place a little lube on it. And just place the bougie just like you would do in a normal patient. And you can see in this case it goes right into the airway. And I don't have studies. There have been a few studies apparently that have shown good results. However, I don't have those studies and I don't think they're big numbers. But the nice thing about the bougie is you know when you're in. If you've used a bougie before, you know what I mean. So I'm not necessarily saying do this if you're unfamiliar, but if you want to try it, I think it's a really cool technique. Then you would just keep the bougie in place, remove the retention strap, hold the bougie, and pull back. It's going to be difficult in the mannequin, easier in the patient, but you're going to be pulling back on your iGEL and your bougie's in place. So I'm going to replace the iGEL real quick and show you the last thing. So if you're not doing apneic oxygenation, be sure and cap this supplemental oxygen port, otherwise it'll be a leak to bagging. Once you place the bougie, you have the option of using the side port for the NG tube. This is a number 10 NG tube. This will be stocked in the airway cart and the airway bag. So it doesn't come with the kit of the iGEL in our case, but we will keep it stocked so you can use it. Two things to note about this NG port. Number one is you're going to see gastric contents, if you're not using the NG, back up into this port. If you do, you have a high aspiration risk, so it's kind of an early warning system. That doesn't mean you haven't already aspirated, but if you see it, you've got some problems. This tube will be placed by placing a little lubricant here, a small amount of lubricant over the port, place the tip in, move it back and forth, and just advance it into the stomach. Again, this is going to be easier in a patient than the mannequin. And there's not much to push on a number 10 NG tube. But I'm going to go ahead and keep trying. Without success. So anyway, this is what it would look like. You would be able to aspirate maybe some thin fluid, but probably not. But mainly decompression of gas in the stomach. And as you know, post-resuscitation, oftentimes patients have large stomach bubbles, which can lead to bradycardia, cardiac arrest, aspiration. It's something that needs to be addressed right away. This allows you to address that immediately. So overall, I think it's a nice device. Let me know how you feel about it. We're going to keep LMAs available for now. Personally, I am switching over to this device and plan on using it more. Again, you can use it for a patient that's difficult to bag. You can use it if you are trying to have a single failed airway attempt and you need a supraglottic device that gives you access to decompress the stomach, apneic oxygenation, as well as bougie intubation attempt. Thank you.